Your ovaries, two small organs beside your uterus, are the architects of your menstrual cycle and hormonal health. They don't just make eggs, they produce hormones like estrogen and progesterone, which affect your mood, energy, bones, skin. Think of your ovaries as conductors of a hormonal orchestra, keeping your cycle in harmony. Each month, they select and mature an egg, a process that's precise and ongoing for decades, but their influence goes far beyond fertility. They're a central hub of your endocrine system, responding to signals from your brain and other organs. When your ovaries are healthy, your cycle is regular and hormones are balanced, but stress or metabolic issues can disrupt their function. This is the foundation for understanding Polycystic Ovary Syndrome, or PCOS, a story of ovarian dysfunction. Understanding your ovaries' role is the first step to understanding what happens when things go awry. Let's see how a healthy ovary works before we dive into what changes in PCOS. Each month, your brain signals your ovaries to begin the cycle with follicle-stimulating hormone, or FSH. FSH wakes up a group of follicles, each holding an immature egg. One follicle becomes dominant, producing estrogen that thickens your uterine lining and signals your brain that an egg is almost ready. When estrogen peaks, your brain releases luteinizing hormone, or LH, the trigger for ovulation. The dominant follicle releases its egg, which enters the fallopian tube, while the other follicles fade away. After ovulation, the empty follicle becomes the corpus luteum, producing progesterone to stabilize the uterine lining. If pregnancy doesn't occur, progesterone drops, your period begins, and the cycle starts anew. This monthly process is a finely tuned system, relying on precise hormonal communication. When this system works, your cycle is regular and predictable. But when the signals get mixed up, as in PCOS, the process breaks down. Let's look at what happens when this harmony is lost. In PCOS, the hormonal symphony goes off-key. The brain sends too much LH and not enough FSH, disrupting the normal cycle. Instead of one dominant follicle, many start to grow but none mature. Ovulation stalls. These immature follicles produce excess androgens, like testosterone, leading to symptoms such as acne and unwanted hair growth. Estrogen levels stay constant, not cyclical, causing the uterine lining to become unstable. The result, irregular periods. The result, heavy periods. The result, absent periods. The ovaries are caught in a loop, unable to complete their monthly masterpiece. This hormonal chaos is the core of PCOS. But why does ovulation stop altogether? Let's break it down. In PCOS, ovulation is like a traffic jam. Follicles start to grow but get stuck, never reach maturity. On ultrasound, they look like a string of pearls, undeveloped eggs frozen in time. High LH androgens block follicle response to FSH, so none become dominant. Enjoying this? Subscribe for more women's health insights. Stalled follicles then produce more androgens, worsening the imbalance. No mature follicle, no estrogen peak, no LH surge, no ovulation. Result, chronic anovulation, irregular periods, absent periods. The ovary isn't broken, it's following the wrong instructions. What's driving this confusion? One key player, insulin. Let's see how insulin fits into the picture. Insulin, the hormone that helps your cells use sugar, plays a major role in PCOS. Many women with PCOS have insulin resistance. Their cells don't respond well, so the pancreas pumps out more insulin. High insulin levels push the ovaries to make more androgens, amplifying hormonal imbalance. Insulin also lowers SHBG, a protein that keeps testosterone in check, so more active testosterone circulates. This double hit, more production and less control, worsens symptoms like acne and hair growth. Insulin resistance links PCOS to higher risks of diabetes and heart disease. That's why PCOS is both a reproductive and metabolic disorder. Improving insulin sensitivity through diet, exercise, medication can restore ovulation and balance hormones. Addressing insulin is often the key to managing PCOS. Now, let's see how all this impacts fertility. If you don't ovulate, you can't conceive naturally. This is the main fertility challenge in PCOS. The hormonal chaos means eggs rarely mature or release, so conception is difficult. Even if ovulation happens, high androgens can affect egg quality. Insulin can affect the uterine lining. That makes implantation harder. But PCOS doesn't mean infertility. Treatments that restore ovulation are often very successful. Understanding the root cause empowers women to seek the right help. With the right support, many women with PCOS do conceive. The key is addressing ovulatory dysfunction. Knowledge is power. Let's see why understanding your ovaries matters. Knowing why your ovaries stop working in PCOS, it's empowering. It's not your fault but a result of specific, often correctable hormonal signals. This understanding helps you ask better questions, seek effective treatments, and become an active participant in your care. It shifts the focus from blame to action, addressing root causes. Insulin resistance and hormonal imbalance. A holistic approach can restore your body's natural rhythm, improving insulin sensitivity, reducing inflammation, supporting brain-ovary communication. This knowledge leads to better health not just for fertility, but for your whole life. Understanding your ovaries transforms you from a passive patient to an informed advocate. Your body has the capacity for balance and health. With the right support, your ovaries can return to conducting their beautiful monthly symphony. If this helped, please subscribe, like, and share.